Hello and welcome to our Healthy People 2020 presentation. Nurses play a huge role in promoting healthcare, and with the influx in measles cases, we decided to choose the objective of reducing measles. Vaccinations are a huge part of preventative medicine and healthcare, and as nurses, it is our responsibility to care for the sick, but also our responsibility to educate health promotion and preventative measures. It is of even more of importance to advocate for our younger patient population that does not have a voice of their own. We must find ways as nurses to not overstep our boundaries with the parents of younger patients, but develop a trusting relationship with them. Once we do that, we can teach them the latest evidence-based knowledge about the importance of childhood vaccinations, discuss the risks versus benefits, and provide additional reputable resources so that parents can make informed decisions rather than being influenced by false information circling the web.
Our objectives. Objective 1. Identify barriers of communication and education that result in non-adherence with the measles vaccination. Objective 2. Identify techniques to provide education and promote compliance with the measles vaccine. Objective 3. Identify nurses' role in promoting vaccination.
So measles is a viral infection that can usually present in a number of ways, but typically we talk about the 3 C's, so cough, coryza, which is runny nose, conjunctivitis or redness of the eyes, fever, and then a rash. The typical rash progression usually starts at the head and works its way down, but that doesn't happen in all cases. Kids can feel quite miserable, like with many other viral infections, but there are some serious complications that can develop as well, including inflammation or swelling in the brain that can leave someone with lasting neurologic or brain damage. It can cause inflammation or swelling in the heart or lungs as well. And so all of these can cause very serious, complicated infections and even lead to death. The biggest myth out there is this link between measles vaccine and autism. This is something that many parents raise to us as their reason for not wanting to vaccinate their children against measles, mumps, and rubella. This is something that comes from a now discredited, retracted study from the late 1990s that came out in The Lancet, has since been retracted from that publication, and all of the co-authors have kind of removed their names from being associated with that paper. But unfortunately, it's kind of really worked its way into the minds of people and has raised this question as to whether there is any link between the MMR vaccine and autism. This has been studied now time and time again, including a large study that came out last week, the largest study done in Denmark, over 600,000 children studied through a population-based registry that again has shown that there is absolutely no link between MMR vaccine and autism. In that study, they also looked at a subgroup of kids who were determined to be at a higher risk of autism, either through risk factors such as having father or mother with advanced age, sibling with autism, and even within that group at increased risk, they did not find any association with MMR vaccine. This is not the first study to show that. We've had multiple other studies. This was the biggest one and has really given us more data to show that there's absolutely no link there.
Objective 1. Identify barriers of communication and education that result in non-adherence with the measles vaccination. Identifying these barriers that we may put up as nurses or barriers put up by the patient can help us as healthcare providers to better facilitate a more productive learning environment. We first need to ask what the patient's primary language is and assess their base knowledge about the measles vaccination. When educating the patient, we should use terms that the patient understands. It's very important that the information pamphlets or fact sheets that we provided are in the correct language and at the appropriate reading level. We have to look for signs of illiteracy as well, because patients may feel embarrassed for not being able to read. This is a huge block to communication and learning. Instead of belittling the patient's current knowledge in vaccinations, we should redirect them to proper resources so they can make an informed decision. We should provide what we can and not give up on the patient. The following video is a skit that demonstrates poor communication skills by the nurse. Can you identify any problems?
Music. Okay. All right. Well, we're just gonna get a checkup today, okay? I mean, it's been an hour.
Good morning.
Oh, good morning.
Are you Mrs. Barrett? I'm sorry, I'm running late, you know what I mean? But I'm here to give your daughter a shot. She's due for her measles vaccine. I think you know this already.
No, yes, yeah. My baby is not getting a shot. We're anti-vaxxers. We don't vaccinate our children.
Did you get any information about it? You know, I only have like the Spanish.
Excuse
You know,
me?
it's pretty much similar to English if you can just, you know, read through that. It'll tell you the positives of getting this vaccine.
Do I look
For your daughter.
do I look Hispanic to you?
Well, I'm sorry. I'm really sorry, Miss Barrett. Let me just tell you about the vaccination. So,
Let me tell you, I'm not giving my daughter the vaccination.
can you tell me your reasons why?
Yes, number one, it's a ploy of the state to inject my child with toxins and diseases to try to control the population. You're not killing off my child. That's number one. Number two, you're not giving my child autism. I've heard that these vaccinations that you're pushing on my child, it causes autism, and I'm not for it.
I'm gonna stop you right there. Who told you about this? I just wanna make sure. I don't know if it was Dr. Google who told you about this.
Yes, I read an article on Google.
And where did this article come from?
I don't know, it's an anti-vaxxer's website.
So you're gonna believe all this and put your child's health at risk? Do you know what measles does to a child if your child doesn't get the vaccine?
Don't try to use the scare tactic with me.
No,
I
scare
believe
tactic.
you're just trying
I think
to.
I'm just being more realistic, and you don't want to read through like the information sheet I gave you. I know it's in Spanish, but you should be able to figure it out, right?
You are so.
Right? Your mom should be able to figure it out.
You are rude and unprofessional. I'm not giving my child any vaccinations. The information
One second.
that you.
Mrs. Barrett is refusing to vaccinate her child for reasons of Google search. Okay, you can continue.
Okay, you know what? We don't have to stand this. If you want to be rude and nasty and put toxins in my child, we can leave.
Nonsense. Where did you get that from?
Google.
Google. Okay, well, I have a couple books for you if you want to read through. These are actual evidence-based books that will tell you exactly what's in the vaccine. And if you still want to make an uneducated choice about your daughter's,
This is the information that you want to provide me?
just read through it, you know what I mean? I think you can be able to figure it out, you know, what's in the best interest of your child.
You know what? I think we need to find another doctor's office that actually
That's your
supports
right.
our anti-vaxxer.
That's your right, but you know what, we have a right to refuse service to anybody who decides to refuse to vaccinate their child because your daughter is putting our other patients at risk.
So now my child is harming other kids? No, we have the herd immunity. While other kids are being vaccinated and their parents are putting toxins in their bodies, my child will be safe. As a matter of fact, they are causing harm to my child. I shouldn't have her around them.
It sounds like you want to take advantage of the herd immunity. Is that what you're telling me? You have no other reasons
Yeah.
why, because somebody on Dr. Google said that.
Yeah, if other parents want to pay to put toxins in their child's body, why not take
Well,
advantage
it
of it?
doesn't seem like I'm getting through to you, so I'm just going to show you the door, the way out, because we can't risk harming anybody else in this office. So, just going to take this and...
And I'll be speaking to your boss. Let's go, Kari.
Goodbye, honey. Bye.
So, what did you identify as a communication and education block from our first scene that would actually promote non-compliance with the MMR vaccine?
First, the nurse came in late, which already started with the relationship on a bad note, and the patient was frustrated by this. So.
The nurse was judgmental and attempted to force the vaccination on the patient. She did not start out the conversation with an open communication and an assessment of the patient's concerns about vaccination. She did not listen to the patient's concerns and maybe questions that she had or beliefs and where she got her information from so that she would know where to start the conversation.
Then the nurse provided the patient with a book of information, and information that wasn't even in her primary language. Nurses should provide patients with, at most, a page of information with the most important information first, and in their language.
Yes, so the nurse started by assuming that the patient was Spanish, so we know that we cannot make any assumptions as a nurse, especially when having a appropriate and therapeutic relationship with our patients. The nurse was insulting, and she actually blocked communication with her closed-ended questions and statements that were somewhat forceful in her approach to have the patient's child vaccinated.
And the areas that the nurse could have educated the patient, like Maggie said, she inhibited the conversation by putting in her own personal beliefs and forcing them onto the patient.
The nurse ended the conversation by showing the patient the door. She could have really used this opportunity to listen to the patient, to allow the patient to express their concerns and the information they have regarding the vaccine. Maybe the nurse could have used that opportunity to inform the patient that autism caused by vaccinations, that whole research was debunked. So she really could have used this opportunity to show the patient information and evidence-based resources to really give her the facts so that the patient could make a better educated decision for the benefit of her child.
And overall, things like this are which is contribute to why we have a Healthy People 2020 goal of reducing measles, because there are communication barriers that may prevent patients from not getting the vaccine.
Which shows that the nurse's role is critical with this Healthy People 2020 objective of reducing measles cases in the United States. The nurse's role is critical because they are the most trusted healthcare professional, as we know, as well, and they are also educators. So it's really important for the nurses to have this education to pass down to their patients in order to really attain the goal of reducing measles vaccines.
Good.
The next video is a skit that shows proper communication between nurse and client. The goal is to promote vaccine compliance by discussing concerns that patients may have and provide proper educational materials conducive to the learning style of the patient. You'll see Objective 2 and Objective 3 in this following video, as it wraps up both the education part and promoting compliance with the measles vaccine, as well as identifying the nurse's role in promoting that vaccine.
Hi. Hi, Kari. I'll be your nurse. My name is Maggie. Hi, good morning. So I understand you and your daughter are here for a checkup? Thank you. You and your daughter are here for a checkup?
Yeah.
Okay. So I looked at her chart and she is due for an MMR vaccine today.
What is that vaccine?
The MMR, so
Yeah.
that's measles, mumps, and rubella. Measles is a serious respiratory disease. It can cause a rash and fever, and it's highly contagious, in some cases deadly. So we do try to educate our patients about the importance of the measles vaccination.
Well, I have a friend last week who came to this office, and she told me that the vaccination causes autism and has poison in it.
Okay, so I actually, do you know anything else about the MMR vaccine or vaccinations in
No.
general?
Mm-hmm.
So are you saying that your belief is that vaccinations are linked to autism? Is that your concern?
Yeah.
Okay, so I actually have this pamphlet here. It's from the CDC, so it's a reliable source. I'm not sure where you got your information before, but I would like to advise that the resources where you get your information from is very important. So the CDC is a trusted resource. There's actually a segment right here. Is there a link between the MMR shot and autism? So the answer is no. Scientists in the United States and other countries have carefully studied the MMR shot. None has found a link between autism and the MMR shot. I understand there was a study not too long ago done that was trying to link vaccinations with autism. However, it was debunked. So it's not true. So I just wanted to give you the most current information. You can have this and hold on to it. Is there any other questions or concerns?
What about the pain? It's a shot.
So yes, I wouldn't minimize it. It is a pinch and the child might cry. But in the end, it's really beneficial to your child to be vaccinated in order to avoid this extremely contagious illness, and also not only protect herself but other children as well. So we want to protect the children that she'll be around when she starts, if she's in daycare, when she starts school. We want to, the goal is to keep these perfectly preventable diseases, to eradicate them essentially.
Yeah.
So the only way to do that, to keep the cases low of measles, is to continue vaccinating.
Alright, well I think maybe we should get it because I don't, little kids, how they have germs and everything, so.
This is true.
Alright,
Okay.
I guess we'll get it.
All right.
It'll be
So,
okay.
all right. So after the checkup, I'll go and get that, and she can sit on your lap. And all right. Thank you so much.
Alright,
All right.
thank you.
So we're gonna have you sit with your mom. Okay. And as a distraction, you can just use this.
Look, the waffle.
So she might get a little upset, which is normal, but you being there to comfort her is always a good thing. So I just want to show you, this is our vaccination. It's a very small needle, and I'll make it quick.
Okay. Where are you going to get it?
So
On our lap?
So on her leg, like the outer thigh area,
Okay.
it's going to be a little pinch, so we're going to clean the area.
Look. Who's this? Broccoli? Broccoli. What about tangerine? Oh, look. That wasn't so bad.
Okay.
Good job.
All right.
Look, now you can run
All
around.
better.
Okay, as you can see, the second scenario was a lot different from the first scenario and provided a lot better outcome.
When the nurse came in, she assessed the mom and her beliefs and where she stood with her ideas on the vaccination instead of coming in with a preconceived notion of what the mother may already have.
Exactly. And when she provided resources, it was number one in the mom's primary language, which was English, and it also was a one-page pamphlet that highlighted the important information and facts about the measles vaccination.
This makes it a little bit more conducive and easier to get that teaching part across to the patient, because when they see something that's a little too much or like language that they don't understand, they may say they understand, but when they leave, this may even actually hinder their decision because it looks too much for them.
Exactly. I believe that the nurse provided all the right roles, did all the right things to encourage the mom to receive the vaccination. She basically did open-ended questions. She asked the mom her input. She used the opportunity to provide education, which actually built the trust between the nurse and the mom, and ultimately made the mom comfortable enough to consent to the vaccination, which is our goal for the Healthy People 2020, to receive the vaccination so that the measles are no longer an issue.
Yes, is that it?
Yep. So, all right. Thank you so much for watching our presentation. We hope you enjoyed.